Welcome back, Nashville. You're listening to A Guide to Healthy Living right here on News Radio 1510 WLAC. We are your local health and wellness experts. We want you to know that health ain't hard, y'all. And I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinhardt.
And each week we want to help guide you through what real health really is. So if you've listened to our show before, you know we've talked about different topics in the past, from headaches to neck pain, low back pain.
Thyroid last week.
Thyroid was last week, and we actually got a number of callers asking excellent questions and a lot of messages through our social media since last week. And I appreciate all our listeners and all the questions that we got from that show.
Yeah, it was a great show in our individual offices, too. Another neat thing is it spurs a lot of questions, and knowledge is power. And the more you understand about your bodies, the better you're able to handle it. And some people just feel helpless all the time. They think that their history is going to dictate what their future is, and that they're just in line for more drugs, more surgeries, just more decreased quality of life. And we're here to tell you it does not have to be that way. You're in control of your future, but you have to make changes to get the results that you're looking for.
Absolutely. So we've got an interesting topic today, and even Dr. Jason and myself even kind of discussed back and forth whether we should even cover this topic because it's a little probably not appropriate for the dinner table, but it's an interesting topic that is very important that we feel like everybody should really know more about and be comfortable talking about with your doctors and know a little bit more about the consequences of this particular issue.
I like this topic because it comes up in my office every week, and it never comes up as the primary reason someone's coming to see me. As I dig further, it always comes up, and it's just it's a topic that it affects just about everyone. I don't want to say it does affect everyone, but it is amazing to me how many people, when we start talking about this, are like, that's me, that's me.
How
that's
common
me.
It really is.
Yeah.
And we're not going to give it away just yet, but this is something that you should be doing at least once a day, if not twice. And if you're not doing this at least once a day or twice a day, you actually are increasing your chance of cancer by almost 70%. Did you know that?
I did know that, and that's one of those things that's, it scares a lot of people, but again, numbers don't lie, and that's what studies are showing.
So our topic of the day is poop.
Yep, we're talking about elimination.
Yes, number 2. Poop, whatever you want to call it, specifically not eliminating, not pooping. Number 2, that's not happening twice a day. So your digestion and constipation are an extremely important part of your body's way to detoxify itself.
Yeah, and I don't know, for me, typically this comes up, it's a female patient that comes in, usually with some form of low back pain, mid back pain, and as we're going through the initial exam history, things like that, I'll start asking, based on where you're having your pain, where your problem is, we know the nerves go to your organs of elimination. Are you having problems with constipation? Oh my gosh, yes. How many bowel movements do you have a week? One, if I'm lucky. Yeah. Maybe 2.
And I've been guilty of this in my past before I realized what my food triggers were. And I'm in the same boat with you guys. If you haven't gone in a couple days, it's uncomfortable. You feel bloated. You feel sluggish. Your stomach hurts. Gassy, your pants don't fit right. It's like being on your period constantly. When you have extra bloating, it's just super uncomfortable. And there's a lot of other stuff that we're going to talk about that it can actually be causing that you may not realize are side effects of not going every day.
And I don't know if it's more common in women than men, or guys are just more like, nah, I'm fine. I don't know which one is the truth. But like I said, typically I find it with women. My guys are like,
same in my office.
Yeah.
Same in my office. I see it more with women. But I did have a patient just this last week, and it was a male, and he's 35 years old. And he said, I didn't realize I wasn't going every day until I was going every day. So it was kind of one of those, he didn't realize he was. So I think that's probably one of our other issues is people don't realize it's not already something they're doing every day because nobody keeps track of that.
Well, I always love to see the look on the patient's face when I'm like, you go once a week? They're like, yeah, I know that's bad. I'm like, I go between 2 to 4 times a day, and they look at me like I'm from another planet. They're like, what are you talking about? They're like, no, you don't. I'm like, I've already gone twice today. I've already gone more this morning than you've got in your whole week.
Exactly. So some of the things that not eliminating daily body can cause is skin problems. This is probably the most common roundabout side effect by not going to the bathroom every day. You can get acne and eczema and those little bumpy, rough feeling skin on the backs of your upper arms. These are all highly correlated with toxic buildup in the intestines. Usually, what's the go-to people go to when they can't go? They go to laxatives.
Yeah.
So I just want to talk real quick on laxatives before we actually give you our tips of the week. Laxatives, especially in children, and they actually have not been cleared by the FDA to be used in children, certain laxatives actually cause seizures and tremors and anxiety issues, aggression, obsessive-compulsive disorders, all these other mental disorders, because as we learn more about the gut, we know it's like the second brain to the body, and the way that they cause the stomach to eliminate unnaturally are triggering these neurological behavior changes in children and some adults as well.
Well, and the issue is, medicine has its place, and thank goodness we have medicine for so many things. But on the other hand, if you need to take a medicine to do what your body is supposed to do on a regular, natural basis, there's a problem there. Your body's not functioning correctly. And that's where I'm always raising red flags with people and saying, why is it that, these people's body, my body, can do this on a regular basis? Your body's supposed to do this on a regular basis. You can remember a time when it did do it on a regular basis and it's not doing it anymore. It's not because you have a laxative deficiency. Something's going wrong with your body. My approach then is we need to get your body fixed so that it works properly.
Absolutely. So the other side effect real quick before we go into our tips is a lot of times when you don't go every day, it would actually cause your low back to hurt. Yeah. And a lot of people will immediately go low back pain. They go to the medicine cabinet and they take ibuprofen or aspirin. Ibuprofen and aspirin also causes constipation. So constipation causing low back pain, taking an ibuprofen for low back pain, which just causes further constipation, and it puts you in this cycle, and down the road, you've got big problems. So if you've listened to our show before, you know that we are both chiropractors, and so one of our biggest tips is chiropractic care, and we're going to touch a little more on that when we get back to explain some of the really interesting changes you see when you do actually get adjusted on a regular basis. But we're also going to talk about babies and the exciting messes that we've had in our office adjusting the little ones who haven't gone in a couple days.
Yeah, that one's always fun. I tell those parents, I'm like, bring a change of clothes and a few diapers because we're going to get this baby going.
Wasn't there a time where you probably needed to bring a change of clothes that day?
There you go. There was. That did. All over my lap.
Yeah. Let's hear that story when you get back. You're listening to A Guide to Healthy Living, and we'll be back here after this short break. Welcome back to A Guide to Healthy Living. This is Dr. Liz Baker.
And I'm Dr. Jason Reinhardt.
And today we are talking about the importance of proper functioning digestive tracts.
Yeah, having regular bowel movements. And we're talking about what we see come in our office on a regular basis, people coming in with low back pain, mid back pain, and the symptoms that are associated with having those kind of problems.
And the biggest one we see, like we've been discussing, is constipation, not eliminating every day, which you should be, once or twice a day. And it's an interesting topic to get into, and it makes people uncomfortable to talk about, but we really should be more open to discussing, especially with your doctors, what's going on. And that's what we're here to give you a couple of tips and things that you can do on your own to help improve more regularity.
And the reason I like to talk about it, if you look at your body has two main ways to detoxify itself. One is through removal, a bowel movement. The other one is through your skin. And if you think about it, which I'm seeing in my office so much, people only eliminating once to twice a week, your body is so toxic, it's not functioning right, and it's not cleaning itself correctly. And that leads down the road to a host of other medical problems.
And like we already mentioned, it opens up the door to increase your chance of colon cancer by about 70%. So this is a really important topic that we need to not just brush under the rug. It's important that you get those toxins out of your body every single day. So let's get right into what we were talking about right before the break is, as you guys know, we're chiropractors, and that's what we deal with every day in our office. Adjustments to the lower back stimulates the nerves that create the motion inside of the intestines to get that stuff working, to get that stuff moving.
Yep. And I always say, you can know, just to make it in the simplest way possible, if those nerves that are going to those organs of elimination are working at, let's just say 30%, those organs are going to work at 30%. There's no way your body is going to regulate correctly. If we can remove interference, get those nerves working correctly, and you say that 30% goes to 80, 90, 100%, what does that look like?
Absolutely. So there's another way that you can stimulate digestion and movement through the bowels is something that we also talked about last week on our thyroid episode, and that is, again, something called vagus nerve stimulation. That's a nerve that comes right out of your upper cervical neck that has branches that goes all the way down to your intestines. So sometimes, especially with babies, when we're adjusting children, we'll find the areas at the top of the neck, at the top of the spine are also misaligned, and that can also be creating dysfunction in how quickly or how often you're eliminating your waste.
Yeah. And Dr. Liz was talking right before we went to break about kind of a funny story that happened to me. And I guess it's funny, in a way that because I was adjusting a little baby and, again, doing exactly what I was talking about, stimulating those little nerves, removing interference so that because that baby had been not able to have a bowel movement for a number of days, and right there, it happened right on my lap to a degree that the baby wasn't wearing a diaper. It needed to get it out, which is a natural thing. The joke was that it happened in my lap, but
he had to change his clothes.
I did, but I've seen that so many times with little ones. You get those nerves working the way they're supposed to, and their body works the way that it's supposed to.
Absolutely, and I had a similar story just about a month ago. Mother and father both are patients in my office. They have a newborn. I guess she's about 6 months now, but she's still pretty small. And they asked a question about that because they had seen me adjusting a baby before. And we went through the whole process. And I said, yeah, bring her in next visit. Let's get her checked out. Just be sure you bring the diaper bag. And they laughed. They thought I was joking. I was like, oh, no, I'm serious. And Dad was a little skeptical. Mom's doing her therapies. I get Mom taken care of, and then I see baby, and then I hand baby off to Dad. And I was like, just wait, Dad, just wait. And sure enough, he goes to the lobby, sits there for a second, and then all of a sudden I see him carrying the baby, at arm's length across the office because he had to take the baby to the changing table in the bathroom because sure enough, within 10 minutes, he was like, she went. And I was like, told ya.
There you go.
It works and it helps in babies, but also in adults. So if you are looking for a chiropractor and you do have issues with, your own personal issues with elimination and you're not going every day, we urge you to give us a call. We've got offices all over Nashville. And if you're tuning in for the first time, we often offer a special to our listeners. It includes a consultation exam, special type of x-rays, and your first adjustment. This is normally over a $250 value, but if you give us a call today for the next 20 callers, it's only $40. We have offices in Brentwood and Franklin, Murfreesboro, and Hendersonville. This offer, of course, is not good for Medicare, unfortunately, but give us a call, 615-727-3107, or check us out online at aguidetohealthylivingradio.com. You can find all our information about each doctor on that website as well. Or again, the number, 615-727-3107. Get on our list for next week.
Yeah. Definitely. And, it's amazing. Some people say, elimination problem, is that a chiropractic problem? Absolutely it is, because the goal of chiropractic is to get your body functioning the way it's supposed to. Most of the time, again, like we were saying, most people don't come in our office saying, the reason I'm here is because I'm not having proper bowel movements. They're saying the reason I'm here is because I'm having issues with my mid-low back. And as we do our thorough examination, we know where the nerves go. We tie that in. We ask these questions, and this is what we're finding out.
And it's very common, and there's a high correlation. Yeah. So give us a call, and let's get you on our schedule in the next week. There's another tip that's coming up. It's not as chiropractic related, but it's nutrition related. So we've got some supplements that we've got to recommend for you as far as things that you can take into your diet or in a supplement form to help with natural relaxation of the intestinal muscles, to help your digestive tract. And these are magnesium and vitamin C.
Again, 2 supplements, so easy to get a hold of, so easy to take, and can make a huge difference.
Yeah, and so magnesium specifically is going to help relax the intestinal muscles, including the intestinal wall, and that's what's going to help your internal ability to go to the restroom more often. But magnesium also does help neutralize your stomach acid, and this is going to also help to move the waste through the intestines. And then, of course, you can take that in supplement form, or in a second, we're going to talk about my top 5 favorite foods as far as high fiber, magnesium, and vitamin C. Then there's also vitamin C, which works a little differently by increasing the speed of the digestive process, thereby increasing your frequency of needing to go to the restroom and allowing food to actually pass through a little quicker to prevent blockages and buildup. So they both work together in a separate way to help push the poo through.
Yeah. Very, very good supplements to take. I also just love magnesium because it's just a natural stress reliever. It's one of those things that you can take to just put you in a calming, I guess, mood, if you will, and it has so many other benefits too. So great supplements to take.
We've talked about magnesium before on the show with aches and pains and joints and muscles and things like that. So it definitely gets to the top of the list that people seem to ignore pretty often. That is pretty commonly deficient in our society. So my top 5 favorite high fiber, high magnesium, and high vitamin C foods. These are actually pretty tasty ones. I'm excited. Actually, I only have 4 here. Sorry. Blackberries, artichokes, acorn squash, and turnips. And this is the white part of the turnip, not the turnip greens, although those are good too.
Yeah, and again, I love all these things because one of the things that we're big about doing is we want to give you tips and advice that are easy to implement into your life. Going to find magnesium, vitamin C, you can find it just about anywhere. And then these 4 foods you just listed, I guess it depending on the season, but you can find blackberries, artichokes, acorn squash, turnips. You're at least going to be able to find one of those probably any supermarket you go to.
Yeah, just about. Or right now at the farmer's market, you can find just about all of those. That's going to put us into our Liz's Lunchbox, which is one of our segments that we like to do. And I always like to give a healthy option, an easy recipe that you can use these particular food items and how you actually could eat them in a healthy, tasty way. So this week's recipe is actually blackberries and roasted acorn squash salad. I'll put the actual recipe with the measurements and everything on our Instagram. It'll be uploaded so you can actually go check that out here shortly. But basically it includes, mixed greens. We always say the darker the better. So go with your arugulas, your spinach, the darker the better. We like that. Roasted acorn squash, which you've never had one, it's pretty tasty. It's kind of a sweeter squash. It's pretty flavorful as far as the squashes go. It's not as bland as zucchini. And then, of course, just pecans and goat cheese, organic blackberries, and just your favorite vinaigrette dressing. And just throw those things together, and we'll explain how to actually roast the acorn squash properly on the actual recipe. But it sounds pretty darn tasty to me. I think I'm going to try it.
Yeah, absolutely. And again, if you need to see exactly how it's done, because excuse me, I'm one of those people that need a recipe because, throwing a little this and that doesn't make sense to me. Go to the website and we have it all listed there.
Yep. At a guide to healthylivingradio.com. You can follow us on Facebook, follow us on Instagram, see what the conversation's going on over there. We've got, I think we just recently hit over 1,000 followers. So go see what we're talking about over there. And we will be right back with some interesting exercises you can do to help speed things up and get things moving better. We'll be back with a Guide to Healthy Living Radio in just a moment. Welcome back to a Guide to Healthy Living. I'm Dr. Liz Baker.
And as always, I'm Dr. Jason Reinhardt.
And this week we actually have a little guest in the studio with us today. She's a recent graduate of chiropractic school as well, and she's just kind of hanging out and shadowing, and I'll let you introduce yourself. Hang on. Is your thing on?
I think it's on. Yeah.
Okay,
Hi, I'm Dr. Beth.
And where'd you go to school?
Life University.
In Atlanta?
Yeah, in Atlanta.
Awesome. Well, how do you like seeing the behind the scenes of the radio show?
This is totally cool.
I know.
I'm digging this.
Awesome.
Yeah.
Well, chime in if you want to. Your mic is on,
Excellent.
and you sat here the first 2 segments. You see how it works. But she's also an aspiring chiropractor and looking to start a practice of her own and see her own patients here in Nashville as well. So maybe you'll see her soon on our trusted list of doctors.
Fantastic. Hope so.
Yeah. So if you're just tuning in, we've been talking about a hot topic, at least in our offices, and it's more of an embarrassing thing people may not want to discuss with their doctors, but it's super important, and it's something that we need to know about because if you're not using the restroom regularly, you're increasing your chances of cancer by almost 70%. And this is an important thing we need to do.
And with a lot of people, I always like to get into why something is important for my patients. And it might be because of health issues, but it might be other things where they're just like, you know what, I'm not able to lose weight. I hate how I look. I feel bloated all the time. I feel uncomfortable all the time. All of those are just as important to me as the possibility of the health issues, because how you feel is how you function, and how you function is how you feel. And if you feel horrible every day because you're so constipated, you're so bloated, there's no way you're going about life happy.
No, and with that, you just mentioned weight loss. If you're not eliminating the waste every day, you're building up more and more toxins, which is going to make it 3 times harder to even lose the weight that you're trying to lose, let alone you're not going to absorb your nutrients properly. If you're trying to eat a healthier diet, you're possibly not absorbing, the healthy food that you're actually eating.
Yeah, there's just so many things. And that's why, and one of the reasons when Dr. Liz and I were talking about doing the show, we're like, well, should we do it? I don't know how this is going to come across. It was like we were both saying, well, again, so many people suffer with these kind of problems that we almost feel like we need to do it because we want to bring this to light and say that it is a huge problem. You're not alone. And these are some easy steps that you can take to get you eliminating properly and feeling the way that you need to feel, because this is something that people are dealing with every day. I mean, if you're chronically constipated and not having regular bowel movement, it's not something that goes away. It just is a continual cycle that just keeps getting worse and worse.
Absolutely. So if you're just tuning in, and we've already gone through a couple of our tips, the first one is we physically have to get the nerve impulses working properly to your intestines so that they can actually function right to help you eliminate your waste. And that's where Dr. Jason and myself and Dr. Beth comes in. We locate the areas of the lower back that are not functioning as they're supposed to, putting pressure on those delicate nerves that can decrease the function of your intestines movement, intestines absorption, and even your ability to just get the nutrients you need to out of your food.
Mm-hmm.
And that's our
important.
job.
Yeah.
So did you have something else you want to say? Oh, okay.
No.
It is very important, though. But we also want to invite you to check out our offices. We each week offer a limited number of spots. We started out with 20 at the beginning of the show. We've only got 15 left because people have already called in. We want to invite you to our offices to see if maybe we can help you out with that problem, because we don't want you to suffer with this anymore, and we don't want you to increase your risk of getting colon cancer. So get into our offices. Let us check you out. We offer each week a special appointment with a consultation, an exam, and special type of x-rays, as well as your first adjustment. It's normally over $250, but if you give us a call, it's only $40. We have offices in Brentwood and Franklin, Murfreesboro and Hendersonville, and give us a call at 615-727-3107, or you can always get more information at aguidetohealthylivingradio.com. Just give us a call and get on our appointment books for next week.
Absolutely. You know what I always say, information without action is pretty much useless.
Yeah.
It's like you heard a bunch of good stuff. Yeah, that was good, but you didn't do anything and you keep on suffering with the same problems. I don't want that for you, so you got to take action to get a different result.
And that's the whole point of this show, is it's a guide to healthy living. It is a guide, but we want you to actually take actions with the information that we're giving you, because we do all the work and we're presenting it to you, but now it's your responsibility to take that information and use it.
So I love that saying. They say a journey of 1,000 miles begins with the first step. So take that first step. You got to move, or else you're just going to keep on staying in the same place. And that's I always say you're growing, you're dying. So there is no really the same place. You got to move towards health.
Absolutely. So give us a call, 615-727-3107. Our second tip was magnesium and vitamin C. Both of these either help relax the muscles of the intestines, or they help to quicken the speed of your digestive process. Either way, both of those are excellent supplements or foods that you could be ingesting to help increase your body's elimination speed and ability. And we talked about blackberries, artichokes, acorn squash, and turnips. Those are my favorite high fiber, high magnesium, high vitamin C foods. And if you want to check out social media, we gave you an awesome recipe for blackberry and roasted acorn squash salad. So check that out on Instagram.
Sounded really good.
It does sound really good. The picture looks even better.
Nice.
I've already made the meme, so it was ready to go. So it'll be uploaded ASAP. Our third tip is going to be more under Jason's realm. This one actually has to do with exercise and movement. So there's actual physical body movement that you can do to help your body's ability to eliminate waste. And My favorite one is just walking. It's the easiest one.
Yeah, you got to get up and move. Our bodies are designed to move. And, recently they came out with saying, prolonged sitting is the new smoking, meaning that sitting for long periods of time without movement is so bad for you. They're saying it's equal to smoking, which blows my mind. But if you look at what happens in the body when you're just sedentary, you put all that pressure on all the systems in your body. I always kind of think of it like you look at a stream that's moving. The stream is healthy. Things are thriving in it because there's movement. Then just go look at a stale pond. There's no movement in the pond. It just
algae.
gets gunk and algae, smells funny. It's not moving. And that's why you'll see
They call that stagnant.
Yeah, they'll put those fountains in it so they can create movement. You don't want your body like that stagnant pond. You want your body like that flowing river. You got to move.
And that's where all the good fish live, is that good, healthy, flowing river, because it's a much healthier environment. So think of that on the inside. You want to have a healthy environment on the inside. So walking, and the reason walking works is when you're upright and your hip flexors and your abs are helping to, move your legs and carry you across the floor, it's actually doing these small, almost like a small intestinal massage. It's helping to push in and move around the guts on the inside just by moving your legs. And if you've ever gone on vacation, you may know that you notice that you go more often, because usually it's because you're walking more than you're used to. It's not necessarily the food that you're eating. It's maybe you're eating better food while you're there. Who knows? But it's also because you're walking more than you're used to.
Yeah. Another one that I love recommending is yoga. Yoga is just fabulous in so many different ways. But yoga is, again, getting the body moving. It's stretching the soft tissues. And another thing that it does is it relaxes you. It'll take your mind from the state that most Americans live in, where you're chronically stressed, which is more of a sympathetic fight or flight nervous system. It'll shift you over to a parasympathetic. That's where your body is more relaxed and where elimination and healing takes place.
And it allows you just to release not only this, stress type of tension, but also physical type of tension that builds up within your muscles as well as in your digestive tract. The downward dog position specifically is one of my favorites as far as tractioning the spine and allowing space to be created within the abdominal cavity to just give room and take, like Dr. Jason said, take that compression off of the intestines themselves.
Plus, these are easy things to do. You can do them at home. You can do them at the workplace. You can do them on vacation. You don't need anything. You just need to get up and move. You can do them anywhere.
And when we're going to add a new segment into our show, and this time we're going to call it Jason's Gym Bag. When we get back, I want to talk about a specific yoga pose, and it's literally called the wind removing pose. So if you know your yoga poses, you may already know what this particular one is. And if you don't believe me, you can Google it. But when we get back, I want to go over what that pose actually is. And between Dr. Jason and myself, we'll try to explain it best we can, because it's not a common one. It's not as common as the downward dog. But stay tuned, because I'd love to go over that with you when we get back. But you're listening to A Guide to Healthy Living, and I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinhardt.
You almost forgot your name there for a second. Stay tuned, and we'll go over that when we return. Welcome back to A Guide to Healthy Living. I'm Dr. Liz Baker.
I'm Dr. Jason Reinhardt.
And we are your local health and wellness experts. And each week we want to help guide you through the path to what health really is. And today's topic is sort of interesting and sort of controversial, and people don't like talking about it, but it's constipation. It's not being able to eliminate your waste every day as you should be, and all the negative side effects that come along with not being able to remove your body's toxins.
Yep, and we know it's a huge topic out there because we deal with it with people all the time in our offices. Again, it's not what they come in for primarily, but as we're tying everything together, it's one of those things that always is coming up.
Every day it does. I mean, people whisper it and they don't want to really talk about it, but you know what? It's okay. You need to talk to your doctor about these things, because there are things that you can be doing or changing or doing differently, or maybe there's one of your medications, it could be a side effect of that you're taking, that you could be altering to help get your toxins out of your body better, to help eliminate the waste, and, for pure vanity reasons alone, eliminate the bloated belly that you have.
And we're all about getting into these topics, bringing them to light, not making them something that needs to hang out in the shadows, and addressing them. Because if you're not having regular bowel movements, if you're like so many of my patients when I first have them come in, it's like once or twice a week, they're miserable. They just don't know there's another way, but they're like, I hate this. I don't know what's going wrong, but I'm gaining weight. All of these things, and I want to talk about it because I want to show people there's another way and that you don't have to live like this.
No, you don't. And a lot of people don't realize that even though it is common, it's absolutely not normal. Those words are not necessarily synonymous. And the problem that it causes with people assuming that it's common is that we've also increased our chances of contracting colon cancer by 70% if you're not eliminating every single day.
Yet you're not removing toxins from your body through the bowels or through your skin, is our body's main way to remove the bad stuff from our body. And you can just imagine, I always say kind of too, it's like, imagine what would happen if the garbage man didn't show up at your house every week to empty the trash. It all backs up. You've seen those garbage strikes when cities have them, and it's all piled up. That's what's going on in your body. Your body needs to be able to have, the trash emptied.
Exactly. And so that's what we're talking about today. And to recap some of our tips that we've gone through already, of course, we're both chiropractors, so that's one of our favorite tips is getting adjusted, getting those nerves in the lower spine moving so that the joints in the lower spine moving so that those nerves have free-flowing information going from your brain to those intestines, telling them what to actually do. It's amazing how often just one adjustment can decrease, the constipation somebody has almost immediately within 10 minutes, even for babies.
Yeah. And we told a little story about, what happened when I adjusted a little one. But again, these aren't rare things. I see this all the time. And, it's just amazing. Get the body functioning the way that it's supposed to. It's going to give you the actions that it's supposed to be doing.
Absolutely. And then if you are interested in wondering if chiropractic care can help you or your family or your baby even, give us a call, 615-727-3107. We've got a few spots left on our schedule this week for a couple extra new patients in there. So give us a call. We offer each week to our listeners a special consultation, exam, and x-rays, as well as your first adjustment. It's normally over $250, but if you call in and mention that you heard us on the radio, it'll only be $40. We've got offices in Brentwood and Franklin, Murfreesboro, and Hendersonville. So give us a call, 615-727-3107. And as always, you can also find more information at aguidetohealthylivingradio.com.
Yep. So should we get in, now that I have my gym bag, should we get into that?
Yeah. So this is a new segment that we're adding in since Dr. Liz gets her Liz's Lunchbox, which is where we talked about adding in more magnesium and vitamin C into your diet. Jason's gym bag is going to include more exercise type things, more movements or weightlifting tips or maybe products that he enjoys. And this particular week is a yoga move called the wind removing pose. And if you don't believe me, it really is called that. Google it. It's called wind removing pose. And since we're talking about eliminating digestive tract blockages, you can imagine what this is going to help you with.
Yeah. So on this one, I'm going to try to describe it so that you can envision what I'm saying, but the most important thing, you're going to start on the right side of your body. You're going to move to the left. So what you're going to do is you're going to lie on your back, both legs extended straight. You're going to draw the right knee into your chest, and you're going to hold it with both arms. Hold it for 20 breaths.
Then slow breaths.
Yes. Then what you're going to do is you're going to put that right leg back down. Then you're going to take your right arm and you're going to extend it overhead, and you're going to stretch out as far as you can overhead. You're going to hold that for 10 breaths.
Yeah. So you're trying to make yourself nice and long.
Correct. And then what you're going to do is you're going to repeat that same process on the left side of your body.
Absolutely. And so the reason for going from right to left is because your digestive tract goes from right to left. It goes up on the right, across the top, kind of under your rib cage, and then back down on the left, and then out the door. And that's the reason we want to always start from right to left.
Plus, it's just a stretch. Again, you can do this anywhere. You can do it at your office, vacation, at home. And it really helps for what we're talking about getting things moving. But it also just feels great to stretch out your body.
Absolutely. And especially if you sit at a desk all day, that's one of the reasons that this is such a common problem.
Yep. So you got to get moving. That's my whole point of the gym bag is motion is life. A stagnant body is going to give you stagnant results. You need to be a body in motion so that the processes in your body can be in motion.
Absolutely. And like I always say, if it's just for pure vanity reasons, this will help with that belly bloat that makes it so hard to get our britches zipped up when we have eaten maybe a little too much sweets or a little too much dairy or a little too much grains, and this will help with that as well.
Yep. And then also in there, we had talked earlier about walking, something you can do anywhere, good to get the body moving, and then just yoga in general. And there's so many different types of yoga. Just, if you don't know where to start, just Google beginning yoga. There's a ton of information out there.
Absolutely. So let's kind of move into our fourth tip, and this is going to be some acupressure points to help deflate the bloat. So some of these feel pretty good, actually. I'll go through some of these because I'm a little more familiar with what these are. But these are pretty easy to do. You can do them sitting at your desk. You can do them sitting in traffic, pretty much anywhere, and you're not going to look too silly doing them if you can't lay in the floor like Dr. Jason's tip just was. This is going to kind of go with stimulating the nerves around the intestines as well. Like we talked about, chiropractic is one way to stimulate nerves. Acupressure points are another way. So the first one, second one, and third one all kind of go together. So I'm going to explain the first one the most, and then the second and third will make more sense. So these all originate from the belly button. So find your belly button, and you're going to place your hand right above the belly button with your 4 fingers together. And right above that top finger is the first point. Right down the middle, you're going to press in and push pretty firmly until you feel a little resistance, and you're going to just rub in clockwise small circles for about 2 to 3 minutes. It should feel sore, especially if you have not eliminated waste in a few days. It's going to be really tender as well. It might even be achy, and it might even stimulate your mouth to water. Any other digestive stimulants are also a good response here because that's what we're looking for. And then you'll do that for a couple of minutes. And then once that's over, then we move downward to just 1 finger width above the belly button. Same thing, clockwise circles, 2 to 3 minutes. It should be achy and sore, just like the one before. And then again, the third spot is actually 4 fingers below the belly button. So all right down the center line there, down the middle of your stomach. If you were to just draw a line straight down the center, you're going along that vertical line there. Do you want to go over anything else about that? Just the clockwise motions versus counterclockwise, or?
Well, and what you're going to feel is when I do this, a lot of times you're going to feel like a tight area, a tight band in there. And as you're doing these motions, my goal always, and you can correct me if I'm wrong on this, but it's to get that band to relax.
Yeah.
The more that I do it, you'll feel, and as you relax in there, you're going to feel that band of, tight tissue start to release. That's what you're looking for.
Yeah, because that toxic buildup on the other side of where you're poking is causing irritation to the not only the muscles, but the other soft tissue around there. And like I said, it should be tender, it should be achy, and it should be a little uncomfortable if there's waste that's building up on the inside causing that toxic symptomatic response.
And just with about anybody, and if you're doing this right now, I almost guarantee people are, if you're doing it right, you're feeling those tight areas.
Yeah, absolutely. And then we've got 2 other spots, and these are not directly on the stomach. These follow more the acupuncture points. And if you know anything about acupuncture, sometimes they look to a completely different part of your body to affect an organ at the other end. So these are actually on your hand and elbow. With your hand, you'll keep your thumb right next to the rest of your hand, kind of like you're making a karate chop motion with your hand. Take your other thumb, and where the crease of your thumb ends, you're just going to dig in and press towards the index finger bone there. Hold it for about 1 minute. Do that on both sides. I will add, though, if you are pregnant, this possibly could stimulate labor. This is also a point that they use to stimulate labor in our pregnant women. So that's one point you can press in on. And then the other point is right at the elbow crease. If you fully bend your elbow, where that elbow crease ends, you'll dig in and press in that same spot there. And you can cross arms and do both arms at the same time and hold that spot for a minute as well. And you actually do, after running through those 5, you do start to feel a little bit of gurgling happening in the stomach, which means you've stimulated some motion down there, which is ultimately our goal.
Yep. Our goal is to get things moving. And again, all these tips, easy to do, but we put it on you. You got to take action. You got to implement them because, again, I like to say, knowledge without action is pretty much useless.
Absolutely. And so we want you to take action. We want you to take those action steps. And if you missed that phone number earlier, it's 615-727-3107. We want to offer you to come into our offices, let us check you out and see if we can help stimulate your nervous system to help stimulate your digestive system.
Yep.
Our special always is normally a $250 value. It includes a consultation, exam, and x-rays. It's only $40 for the listeners of our show. Just be sure you mention that you heard us on the radio. We've got offices in Brentwood and Franklin, Murfreesboro, and Hendersonville. And again, that number, 615-727-3107. We urge you to call us. I want to throw in one really last quick tip here.
Okay.
This one should be obvious, but I'm always surprised that people don't know it is. One of the other best things you can do is just drink enough water.
Yep. Stay hydrated.
Stay hydrated. Drinking at least 2 liters a day will really help this problem as well. But you're listening to A Guide to Healthy Living, and we're done for the day, and we'll catch you next week.
Have a great week.